Let's talk about a case that turned out so great. A 28-year-old man comes in to see me. Here was his complaints, and I'm going to talk about what was wrong, what we did, and how much better he's doing from a chronic low back pain situation. So he says, my left leg constantly bothers me. He's 28 years old now, and it affects my daily routine. And he said, I take over-the-counter arthritis drugs for it, and it really is not helping. So that's how we started. And I said, so when did this all start? He says, I was 12 years old, and I fell off my bike, and I fell onto my rear end, and I hurt my back, and I've been in pain ever since. Age 12, now to age 28, chronic pain. So he gets into high school, and he's communicating to everyone, my back hurts, what's going on? Gets an MRI, nothing seen. He gets a second MRI when he's 20 years old, still nothing seen, has some physical therapy, and in this case, physical therapy didn't work. He had 2 cortisone shots in his lower back, one at age 20 and one at age 26, both of which gave him 2 to 3 months of relief, but then the pain came right back. He had more physical therapy about a year ago. Unfortunately, in that case, again, it didn't work. Physical therapy oftentimes works, but in this case, it did not. And so he's got low back and left leg pain, as I said. And at the end of the day, it gets much, much worse. And at the end of the day, it can be an 8/10. So pretty significant pain. So luckily, he knows this couple that has been patients of mine for several years. And this couple got great results with chiropractic. And they've been after him, like, try the chiropractor, go and see the chiropractor, give it a try, what else you get to lose, and so forth. So fortunately, in the summer of 2022 here, he says, I'm going to give it a go. I'm 28 years old. This is how it's going to be forever, right? So we start working on him. Now, in his case, we did not do any manual chiropractic adjusting. So none of the cracking and popping and snapping that some of you are familiar with at the chiropractor. We just chose not to do that. So we went light force, as we call it. I used my specialized drop table to make adjustments to the bones and tissues and stimulate nerves. I used my light force instrument, and I used some vibration tools that I have as well. On top of that, I gave him specific exercises at home, which we've talked about many times, and off to the races we went. So I saw him 3 times a week for 4 weeks. In 4 weeks, he is 80% better. His lower back is now, sometimes doesn't hurt at all, 0, and it only goes up to a 1 now in his lower back. Most of the leg pain is gone. He has remaining left foot numbness. Now that's getting better, and at times he doesn't feel that at all. And even in just the past few visits, since I told you about this reevaluation time, he's even getting better. He says, he comes in and says, I can't believe this. I can't believe how good I feel. He's a tradesman. He works as an electrician, so he's working his body over during the course of the day, which used to, as I said, hurt him a lot at the end of the day. He says, many times he's coming in now, he's like, I don't have any pain at all. A little bit of numbness in my foot at the end of the day. He is so happy, as you can imagine. So here's a young man, 28 years old, 16 years of chronic low back pain and leg pain, thinking, I guess this is just the way it's going to be. Nope, we have turned that around. Keep in mind, not everybody gets that amazing of a result. Lots of people do, not everybody does, and it doesn't work for everyone. But just keep that in mind. He stayed the course, he made his visits, he did all of his homework, he felt a tiny benefit after visit number 1, which said, oh, I gotta do this, I'm gonna do everything that he says. He took it to heart, and he's doing so much better now. Now he's only coming in once a week. Pretty soon, he's probably going to be maintenance care once a month. Okay, but that is a fantastic case. And by the way, there's some questionnaire forms that we can fill out that are well used in the medical community to assess how people are doing. This one is called a functional rating index. And obviously in this rating index, it talks about how is your sleep affected and your work and your recreational activities and driving and sitting and all these kind of things, right? So you can rate that in the beginning and then rate that later on down the road. This is a score of 40. If you're 40 over 40, that's like severe and you're in the hospital, probably on a morphine drip or something. And 0 over 10 would be perfect. You know, everything is unaffected by any pain whatsoever. When he started, he was at a 21 over 40. Just in that first reevaluation, he is 8 over 40. The next one we expect is going to be even better than that. So here's another case of a young man really turning around and setting himself up for a much, much better life now, and just not having pain is such a wonderful thing. I'm Dr. Scott Fuller.